At 7:20 on a quiet Tuesday morning, Eleanor, a 74-year-old patient of mine, took her blood pressure pill exactly the way she had done for years. Nothing seemed unusual. She wasn't in pain. She hadn't eaten anything strange. She didn't feel sick enough to worry anyone. But by noon, her daughter was rushing her to the emergency room because she was weak, shaky, dizzy, and barely able to stand. As I reviewed her case and ruled out the obvious causes, something became very clear. The problem was not that her blood pressure medication had suddenly stopped working. It was not a hidden heart attack. It was not simply old age catching up with her. It was a mistake she made in less than 30 seconds at her kitchen counter. A mistake I see again and again in adults over 60 who take Amlodipine, Losartan, or Lisinopril. And unfortunately, many seniors make it because no one ever explained to them one critical truth. These three medications may all be used for blood pressure, but they do not play by the same rules. Today, I'm going to explain what many people never get told about these drugs, the warning signs seniors often dismiss, and the simple daily checks that can help you avoid a fall, a dangerous side effect, a kidney problem, or an emergency trip to the hospital. Hello, I'm Dr. Clara Hoffman. Over the years, I've treated countless adults with high blood pressure, heart strain, medication side effects, dizziness, swelling, dehydration, and the silent complications that too often build up before anyone realizes something is wrong. And if there's one thing I wish more seniors understood, it's this. A blood pressure pill is not just a blood pressure pill. The label may look simple, the bottle may look familiar, but Amlodipine, Losartan, and Lisinopril affect the body in very different ways. And when people assume they are basically interchangeable, that's when trouble begins. Millions of adults take one of these medications every day. And that's not a bad thing. When prescribed correctly, they can be extremely effective. They can reduce the strain on the heart. They can help protect the brain from strokes. In the right patient, they can even help protect the kidneys over time. But what many seniors don't know is that each of these medications has its own personality, its own weak spots, and its own warning signs. And if you don't know what to watch for, you can mistake a dangerous side effect for just aging, just stress, or just a bad day. Let's start with the first big misunderstanding. Many people think Amlodipine, Losartan, and Lisinopril all lower blood pressure the same way. They do not. Amlodipine works mainly by relaxing the muscles in the walls of your blood vessels. Think of it like loosening a tight garden hose so water can move through more easily. When the vessels relax, pressure inside them drops. Lisinopril works differently. It affects a hormone system in your body that helps control blood pressure and fluid balance. It tells the body to stop tightening blood vessels so aggressively. In the right patient, that can be very helpful. But it also means this medication can interact with dehydration, kidney function, and potassium levels in ways many people never expect. Losartan works in a similar hormone pathway, but by blocking the message at a different point. It is often chosen when someone cannot tolerate Lisinopril, especially because Losartan is less likely to cause the dry cough Lisinopril is known for. So yes, all three can lower blood pressure, but they do not carry the same hidden risks. And that is exactly why Eleanor got into trouble. She had been taking Losartan for years and was doing reasonably well. Then she developed what she thought was a minor stomach bug. She ate very little, she drank less than usual, she had some diarrhea. She felt tired, but she still took all her medications exactly as she normally did. Later, because of knee pain, she also took an over-the-counter anti-inflammatory tablet. By the time she reached the hospital, her blood pressure had dropped too low, she was significantly dehydrated, and her kidney numbers had worsened. What shocked her family was this: she thought she was being responsible. She thought taking her medication, no matter what, was the safest choice. But in some situations, especially in older adults taking medications like Losartan or Lisinopril, the body's condition on that particular day matters just as much as the prescription itself. And this is what many seniors don't know. The danger is not always the pill alone. The danger is the combination of the pill, dehydration, poor food intake, over-the-counter medications, and warning signs that go unnoticed. Let's talk about Amlodipine first, because it may be the easiest one to misunderstand. Amlodipine is often well tolerated. Many people take it for years without major problems. But one side effect is so common and so frequently dismissed that it creates confusion all the time: swelling in the ankles and feet. I've had patients come in telling me they thought they were retaining a little water, gaining weight, or just getting older. But sometimes what they were seeing was medication-related swelling from amlodipine. Why does that happen? Because amlodipine relaxes blood vessels in a way that can allow fluid to shift into the tissues, especially around the lower legs and ankles. And in seniors who may already have less efficient circulation, that swelling can become very noticeable. Now here's the important part. That swelling does not always mean heart failure. And this is where people get scared. They see puffy ankles and think the heart must be failing. Sometimes it is the heart, yes, but sometimes it is the medication. The problem is that many seniors never report it. They just live with it. They tighten their shoes less. They stop walking as much. They think, well, this is what happens at my age. No, not always. And if the swelling is new, worsening, or one-sided, it needs attention. Now let's move to Lisinopril, because Lisinopril has a very different trap. One of the most common things seniors don't know about Lisinopril is that a dry, nagging cough can be caused by the medication itself. I've seen people treated for allergies, sinus issues, reflux, and repeated throat irritation before anyone asks the simple question, when did the cough begin, and did it start after Lisinopril? Sometimes the answer is yes. And if no one connects the dots, that patient can spend months exhausted, irritated, and sleep-deprived from a cough caused by the very medication they're taking every day. But Lisinopril has another issue that matters even more. It can raise potassium levels and affect kidney function, especially if the body becomes dehydrated or if it is combined with certain other drugs. That means a senior can be stable for months, even years, and then suddenly run into trouble after vomiting, diarrhea, a fever, poor appetite, or the addition of an over-the-counter pain medicine. And this brings us to Losartan. Many people assume Losartan is the easy one because it often causes less cough than Lisinopril. And in some patients, that's true. But what many seniors don't know is that Losartan can still contribute to high potassium and kidney stress when the body is under strain. So if you take Losartan and think, at least I'm not on Lisinopril, so I don't have to worry, that is a dangerous assumption. You still have to pay attention. And this is where the hidden accomplices enter the story. The first silent accomplice is dehydration. As we get older, the thirst signal becomes less reliable. Many seniors do not feel thirsty until they are already behind. Add a hot day, a poor appetite, loose stools, a virus, or simple fatigue, and suddenly the body is running low on fluid. Now imagine the kidneys as a delicate filtration system that depends on steady blood flow. In a younger, resilient body, there may be more room for error. But in an older adult, especially one taking Losartan or Lisinopril, dehydration can tip that balance quickly. Blood pressure falls, kidneys receive less flow, waste products begin to build, weakness and dizziness set in. And if potassium rises at the same time, the electrical system of the heart can become unstable. That can mean palpitations, unusual weakness, a heavy, sluggish feeling, or in severe cases, something far more dangerous. The second silent accomplice is the pain reliever many people take without a second thought: ibuprofen, naproxen, and other anti-inflammatory drugs. This is one of the most common medication traps I see in older adults. A senior wakes up with back pain, knee pain, or arthritis pain. They take their prescription blood pressure medicine in the morning, then later they take an over-the-counter anti-inflammatory because it's just something small. But that small decision can become a big problem. Why? Because those pain medicines can reduce blood flow into the kidneys. If you combine that with dehydration and then add a medication like Lisinopril or Losartan, you create the perfect setup for kidney stress or even acute kidney injury. The person doesn't feel a dramatic disaster in the first minute. Instead, they feel off. More tired, more lightheaded, less appetite, maybe less urine, maybe a little nausea. And because these signs are vague, many seniors wait too long. The third silent accomplice is potassium hiding in plain sight. This one surprises people. They hear potassium and think bananas. But that's not the biggest problem. The bigger issue is often salt substitutes and supplements. Many salt substitutes use potassium instead of sodium. So a person with high blood pressure, trying hard to be healthy, cuts back on salt and starts using a substitute heavily on everything they eat. Sounds smart. But if that same person is taking Lisinopril or Losartan, potassium can quietly climb. And high potassium is not something you can reliably feel early. Sometimes there are no symptoms until it becomes serious. Sometimes people notice weakness, a strange heaviness in the body, unusual fatigue, or heart rhythm changes. Sometimes the first clue comes from a blood test, and sometimes that blood test is delayed until the person is already in trouble. The fourth silent accomplice is what seniors dismiss as normal aging. This is perhaps the saddest one of all. Ankle swelling gets blamed on age. A dry cough gets blamed on age. Dizziness gets blamed on age. Getting up and feeling faint gets blamed on age. Feeling wiped out after a stomach bug gets blamed on age. But sometimes it is not age. Sometimes it is the body trying to tell you that the medication, the fluid balance, the kidneys, or the electrolytes are no longer in the safe zone. I remember a patient named Martin, 71, who came to see me because he was feeling a little slower than usual. That was how he described it. Just slower, more tired, slightly weak in the legs, no chest pain, no dramatic symptoms. He was taking Losartan. He had recently switched to a low-sodium diet and started using a salt substitute heavily. He also had not been drinking well because he was trying to avoid waking up at night to urinate. His potassium level came back much higher than he expected. He had no idea any of those pieces connected. That is the problem. Most people are never taught how the pieces connect. So let's connect them now. A senior wakes up already a little dehydrated. They take Lisinopril or Losartan as usual. They are not eating much because they feel off. They take ibuprofen for pain. They use a salt substitute because they are trying to be healthy. They ignore the weakness, the dizziness, the lower urine output, the new swelling, or the unusual cough. And then suddenly, what looked like a normal day becomes an ER visit. Now, before anyone misunderstands me, let me be very clear. I am not telling you to stop your blood pressure medication on your own. That would be another dangerous mistake. Uncontrolled blood pressure can damage the brain, heart, kidneys, and eyes. These medicines can be extremely valuable when they are used correctly. What I am telling you is that seniors need to stop treating these medications as if they are all interchangeable and harmless in every situation, because they are not. Amlodipine has its own pattern, Lisinopril has its own pattern, Losartan has its own pattern, and if you understand the pattern, you are far safer. So let me give you something practical, something simple, something you or your loved one can actually use. I call it the 5-point blood pressure medication safety check. Every morning, before treating your routine like it's automatic, pause and run through these 5 questions. First, how do I feel today? Really, not how do I usually feel. How do I feel today? Am I vomiting? Do I have diarrhea? Am I barely eating? Do I feel feverish? Am I unusually weak? Am I more dizzy than normal? Because if your body is off, your medication day may need more attention than usual. Second, have I had enough fluid? Unless my own doctor has placed me on a fluid restriction, many seniors start the day already behind. And when you are on blood pressure treatment, especially Losartan or Lisinopril, dehydration matters. Third, what is my blood pressure actually doing? Not what I assume. Not what it was last week. What is it doing now, measured calmly, correctly, after sitting quietly for a few minutes? Because guessing leads to fear, and fear leads some people to do the worst possible thing. Take an extra dose without medical instruction. Please do not do that. One of the most dangerous myths seniors believe is this: if my pressure is high right now, I should just take more. No. That can backfire badly, especially later in the day, causing dizziness, falls, weakness, or dangerously low blood pressure. Fourth, am I noticing any warning signs? If you take Amlodipine, look for new or worsening ankle swelling. If you take Lisinopril, pay attention to a persistent dry cough and never ignore swelling of the lips, tongue, or face. That can be an emergency. If you take Losartan or Lisinopril, be alert for unusual weakness, palpitations, severe dizziness, reduced urine output, or signs that your body is simply not tolerating the day well. And fifth, what else am I taking today? This question alone has saved patients from trouble. Am I taking ibuprofen or naproxen? Am I using a salt substitute? Am I taking potassium supplements? Am I accidentally taking 2 medications from the same family? Am I mixing old prescriptions with new ones because the bottle still had pills left in it? Never underestimate the medicine cabinet. It is one of the most dangerous rooms in the house when people stop asking questions. Now let's talk briefly about one more hidden issue that too many seniors never hear clearly enough. Lisinopril and Losartan are not the same drug, but they are cousins in how they affect the blood pressure control system. And unless a physician has specifically instructed otherwise for a very unusual reason, people should not be casually taking both together. Yet sometimes this happens during medication changes. A person keeps an old bottle, a new one is added, names are forgotten, labels are confusing, and suddenly there is unintentional overlap. That is why I always tell my patients, carry an updated medication list. Bring every bottle to appointments if needed. Never assume the doctor's office can guess what you are actually taking at home. The safest patients are not the youngest patients. They are the most informed patients. And the good news is this: you do not need to become a pharmacist to protect yourself. You just need to become more intentional. If you take amlodipine, watch for swelling and dizziness. If you take Lisinopril, watch for cough, swelling of the lips or face, kidney issues, and potassium-related risks. If you take Losartan, remember that less cough does not mean no monitoring needed. You still need to watch hydration, kidney function, and potassium. And above all, never make dose changes on your own because of a single reading, a bad morning, or fear. Talk to your doctor. Ask what warning signs matter for your specific medication. Ask whether you need lab monitoring. Ask what to do if you get sick with vomiting, diarrhea, or poor intake. Ask whether an over-the-counter pain medicine is safe for you. Ask whether a salt substitute is appropriate for you. These are not small questions. These are the questions that prevent big problems. Eleanor, the patient I told you about at the beginning, recovered, but her story changed the way her family handled medication forever. Now they know that take it every day is not the only instruction that matters. They understand hydration. They understand over-the-counter interactions. They understand that symptoms should never be dismissed just because someone is over 70. And most importantly, they understand that blood pressure treatment works best when it is monitored, respected, and adjusted thoughtfully, not blindly. Caring for your blood pressure is not just about lowering a number. It is about protecting the brain without harming the kidneys. It is about helping the heart without ignoring the warning signs. It is about knowing that the right pill can help you tremendously, but only when it is matched with the right awareness. So if you are taking Amlodipine, Losartan, or Lisinopril, let today be the day you stop guessing. Read the label carefully. Know which one you take. Know what it can do. Know what it can hide. And know when your body is asking for help. If this message helped you, I want you to do two things. First, leave me a comment and tell me which one you or your loved one takes: Amlodipine, Losartan, or Lisinopril. Second, share this with a parent, a spouse, a sibling, a neighbor, or any senior you care about. Because sometimes the difference between a normal day and a medical emergency is not a dramatic disease. Sometimes it is one overlooked warning sign, one misunderstood side effect, or one small decision made in less than 30 seconds. Take care of yourself. Take care of the people you love. And never underestimate what your blood pressure medication may be trying to tell you.